Today I want to talk to you about irregular bleeding. I see a lot of women who have no regular pattern to their bleeding. What's normal is a monthly menstrual period. Monthly being roughly once a month. Not every 28 days necessarily, but on some kind of pattern every 30 or 32, whatever it may be. But I see a lot of women who finally break down and come in and have irregular bleeding. Well, they may have had irregular bleeding for 10 years and never gone to see anyone. Or it may have just started last year, for instance. And it can come in any type of pattern. Some women will bleed very lightly every now and then for a short period of time. Some will bleed lightly every now and then for a long period of time, like weeks or months. Some women will bleed extremely heavily, like hemorrhage, for a few days every now and then. And some will bleed extremely heavily for long periods of time. So there's no pattern to it. That's the point. No rhyme or reason. Some women become severely anemic doing this and end up in the emergency room with a blood transfusion. Don't let that be you. You don't necessarily have to have one type of bleeding pattern that I just mentioned. It could be several different types. It means you're probably not ovulating. So it's important to understand what happens in a normal menstrual cycle. A normal menstrual cycle means you're having these bleeding episodes about once a month, and right in between, or 2 weeks before your period, you ovulate. Your ovaries are giving you estrogen all month long, but not at the same level. It rises and falls through the course of the cycle. And at ovulation, your ovary spits out an egg. The thing left on the ovary, where the egg came from, then starts to produce your other hormone called progesterone. You only have the progesterone around for 2 weeks. If you don't get pregnant, if no fertilized egg lands inside the uterus and starts making placental material, that thing on the ovary that was making progesterone shrivels up and dies. Your progesterone stops suddenly. That triggers a withdrawal bleed or a menstrual period. And then the process starts all over again. You start recruiting a bunch of eggs in your ovary, and they're producing estrogen, making the lining of the uterus grow and get thicker and thicker. You ovulate, the progesterone matures the endometrium or lining of the uterus. You don't conceive, the thing making progesterone dies, you have a menstrual period, and over and over and over. So, women who don't ovulate, their body never gets that progesterone, they just have the estrogen. So what does estrogen do? It makes the lining of your uterus get thicker and thicker and thicker. Well, it's not stable. And if I had a whiteboard like I do in the office, I could draw you a picture, but it's not stable. And parts of it break off, and that's what the irregular bleeding is. If a little bit breaks off, you have light bleeding, it can heal itself over. If a lot of it breaks off, you might have really heavy bleeding, and so on. So it's the fact that you're having irregular bleeding tells me you're not ovulating. So that begs the question, why aren't you ovulating? Well, there could be a lot of different reasons for it. But the bottom line is, let's try to fix it. while we're finding out what's causing it. So to fix it, I usually get an ultrasound first to see how much tissue is in there. If it's a certain thickness, my mind is thinking, oh, this person, if I give them progesterone now, they're gonna hemorrhage and it's gonna be a nightmare for them and they're gonna end up in the ER. Maybe we need to do something different for that person, like clean it out in the operating room with a D&C. That doesn't happen very often. Most women, after the ultrasound, or even before sometimes, and it's quite variable depending on how long the process has been going on. But at some point, before or after the ultrasound, they're gonna get oral progesterone. They take it by mouth at bedtime. And then it causes changes in the endometrium or lining of the uterus, just like they would experience if they had ovulated. And I like to give the progesterone continuously, and then that tissue will get thinner and more mature, and parts of it, it'll bleed out eventually. All that tissue will come out. It may come out in the form of a menstrual period. Another way to give the progesterone is for 2 weeks, just like the ovary would have done it. And when you stop it, it will cause you to have a bleed that will clean out your uterus. But again, it might be a heavy one, so I try to do things to avoid that actually happening. Now, in addition to the ultrasound, I do labs. I have a whole panel of labs that are done before you start taking progesterone. And I kind of simplified the process of ovulation. It actually starts in your brain, in the hypothalamus, which sends a hormonal signal to the pituitary gland, which sends out hormones into your bloodstream that make the ovaries do their thing. So we have to check all those things. So there's 8 hormone levels that we do. And there are various things that can go wrong. The pituitary gland also makes prolactin. You can have a teeny tiny tumor up there that's making too much prolactin. That can make it not work, so you're not having regular periods. So if the hormonal panel is normal, let's start with that. Then we've already looked at you as a whole person and your family history. Do you have a family of diabetes, family history of diabetes? Are you overweight? I've already asked you about what you drink, because one of the biggest things I see around here is people drinking sweet tea or Coke all day long. Makes them gain weight, puts them into that cycle of not ovulating. So it's a lot more complicated than that, but that's just skimming the surface. So we do the hormonal panel, then we move on to fasting labs, and in that fasting lab panel, with the cholesterol and thyroid and kidney and liver function and blood count, I also check for diabetes with a screening blood sugar and a hemoglobin A1C. If you take all of the women that don't ovulate, about half of them are pre-diabetic, and there are varying degrees of pre-diabetes, insulin resistance, impaired glucose tolerance, and then on to diabetes. And there are medicines to help treat that, especially in women that want to have a baby and can't because they're not ovulating. But that's a complicated issue that we talk about in the office. Let's talk about the long-term problems. In the women that don't get treatment, that have this pattern of bleeding for years and years and years, in addition to the risk of severe anemia, there's a risk of cancer in that tissue in the lining of the uterus. endometrial cancer, uterine cancer. That's mostly how it happens. Years and years and years of never getting cleaned out. It takes 10 to 15 years, granted, but believe it or not, some women go that long without getting checked. Another issue is you can't conceive if you're not ovulating. And as I said, there are ways to help with that and medications you can take. And it's one of the things that I just do a lot of in the office. And I would be more than happy to see you and help you if you have some of these problems. I also have 6 other providers that do the same thing, 2 doctors, 3 midwives, and a PA. Thank you.